Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson, and today we're joined by Dr. Anna Esparham, founder of Health is PowHer and Pain-Free Life Academy, and the host of the Health is PowHer podcast, which is amazing. Anna is a nationally recognized physician who healed herself from multiple chronic conditions, including autoimmunity and chronic pain, and she now helps others do the same. And today, we're talking about all things fibromyalgia. Anna shares her expertise and understanding of this complex illness, as well as her effective treatment approach that incorporates scientifically founded use of spirituality to heal. This episode is for everyone, whether you have fibromyalgia or not. Anna, welcome to the podcast.
I am so excited to be here, Julie. Thank you for having me on the show.
Thank you so much for joining us. We probably could have recorded 2 episodes already with the conversation that we've been having before I hit record. I already know what goodness the listeners are in for. You have an incredible story, an incredible journey, and I would love to have you, introduce yourself to listeners via your journey, and then we'll dig into the rest of the conversation.
I love the origin story, and I love hearing everyone's stories too. I do that on my podcast as well. It's so interesting how we got to where we are today. I am a medical doctor, and so conventional trained. But I really got into more of the integrative and functional and spiritual side because I got so sick, especially at the first year of medical school. I had to repeat a whole bunch of immunizations because I never had chickenpox when I was a kid, and then I got mono all at the same time. And then something crazy happened where I was so incredibly sick and bedridden that what happened was I developed this severe polyglandular autoimmune disease. And then everything snowballed from there, where I developed all these chronic pain syndromes as well. And I was in so much pain, so sick. I was bedridden, trying to get through med school, trying to get through residency. And, the conventional medicines, even though steroids, they helped me get by. I mean, I could at least not get on disability and go through,
function.
sort of function. And well, that's what led me to, I was like, no way, I need to have quality of life. I need to get through, med school and residency. And so that's what led me to Dr. Jeannie Driscoll, who was the head of integrative medicine. She actually, not a lot of people know about her. She's a integrative medicine physician that has really led the way and led the field, along with all these other people at the Institute of Functional Medicine and Integrative Medicine, where she created the Integrative Medicine Fellowship. I mean, she's done a ton for the world on integrative cancer therapies. And she got me better through nutritional changes, dietary supplements, IV vitamin C or IV Meyer's cocktails, because I had So she created this integrative medicine fellowship. She really created, the way for integrative cancer therapies across the world and integrative cancer care. And anyway, she started me on, nutritional changes, dietary supplements, IV vitamin C, because my adrenal glands were completely destroyed. I went into menopause, at age like 23 or 24. And so then I started feeling better, but I wasn't completely a lot better. There was so much pain going on, and, the conventional system just wasn't helpful at all. And there was a point in the time where I was at an academic medical center where we did have to start getting mandated, immunizations, and that was fine. And I got the first flu vaccine, but then I doubled over and experienced severe pelvic pain where I was puking on the toilet. I mean, it was crushing. It was excruciating. It was like, I have so much of a pain threshold. I went through peritonitis and I was just fine, like at age 14, and which is like an infection of the belly and the pelvis, and because my appendix burst, and I was like living with it for 3 months, and I was like totally like not I was not complaining. And that's just me. I just don't complain about pain. And anyway, I didn't know what was going on, and I got treated for this chronic pelvic pain, bladder pain syndrome, interstitial cystitis, and for a year, I started getting better. I was better, got the second, immunization. And then all of a sudden I started getting some whole body pain, started getting some anaphylaxis type symptoms, not shock yet, but I didn't still know. But then my doctor was still kind of like, well, there might be an association there. Let's just keep checking you out. So anyway, I was dealing a lot of myalgias that year. Then the third time, I almost died. I went into anaphylactic shock. I developed severe pain throughout my entire body. Obviously, it, developed into severe fibromyalgia. It maybe even having a small fiber neuropathy, who knows? But so that's what kind of led me down this chronic pain path. As I'm also a headache and pain doc too. So it's like, as I'm an integrative headache and pain doc, I'm dealing with, this fibromyalgia pain. And it's funny because even with all my knowledge, it was like, how do I get through this? I had so much muscle weakness, fatigue, brain fog, sleep issues. And it was so difficult. And so that's kind of what led me to where I am, really focusing a lot on chronic pain and fibromyalgia for women, especially, just because I feel like a lot more women do get chronic pain and fibromyalgia more so than men. There's a lot of hormonal issues related to it, but it's a big passion of mine. And that's why I'm also going back to residency.
Which is incredible. Honestly, incredible.
I just go back. I'm so scared. I'm like, oh, what am I doing? I'm going to go back to residency in osteopathic neuromusculoskeletal medicine because it is so important in treating the whole body, the myofascia, the nerves, the joints, the tissues, the muscles, the bones, everything to help both chronic pain and fibromyalgia. And so I got accepted into this program. So I'm super excited. But yeah, it's just strange how this kind of led me to help people with chronic pain. And even though there's this medicine side, all the while, the biggest thing that truly healed me, I believe in medicine, and I think medicine is wonderful. I think both conventional medicine and integrative medicine and functional medicine, all of it is just incredible. I just think I only got 30 to 40% better with that. And the biggest thing that truly helped me was the spiritual side, that intuitive side, really connecting with my spirit, my higher self, connecting with God and with my faith, Jesus Christ, and working on that spiritual healing, because that was the only way that I truly healed, 100%. So yeah, so that's my story.
Which is so incredible, and you are healed 100%. So
yeah.
You're pain-free.
Well, so we're not ever completely pain-free. We're always going to experience pain. And so anytime like I am overly stressed, or if I ride in a car and my biomechanics are a little bit off, or my posture is bad, I will experience like some shoulder pain, or like maybe some thoracic pain, some hip pain, but it's never that type of pain that is just chronic, continuous, constant. I mean, excruciating. And so pain is a good thing. It's very protective for us. It's more of a a message to us, which we'll probably get into.
Yep.
But yeah, so it was amazing to me how the spiritual side, even though I'm very scientifically based as a, board certified, triple board certified physician, maybe I'll be quadruple board certified after this residency.
Oh my gosh.
But I just believe in the spiritual. That's the foundation for healing.
And I want to throw in there for listeners, because we often talk about self-care. We could do a whole nother podcast on what is going on at medical school. I mean, yours was different, a little different, because I've interviewed so many docs who, their autoimmune journey either started or really became unbearable in medical school. And I'm like, I really think we need to revamp medical school. And yours, I know, was more, vaccine inoculation related, but I do want to throw out there, because we got to talk before I hit record, that we talk all the time about this, overachieving, go, not taking care of yourself, running yourself down. So I want to, for the listeners that aren't familiar with you, you listen to your body, you take good care of yourself, you know what you need. And yes, you might be you are what I would call a high achiever. But you do it in a way that's healthy for you, so that you can continue to contribute to your patients and clients. And so I wanted to add that qualifier, because I'm sure listeners are thinking wait,
how on earth?
Yeah. And for those of you that are listening and not watching, talk about a vibrant human.
Thanks so much. Yeah, no, I do think there is because I'm also a pain doc, and this is what I do a lot with pediatric patients, as well. And we always talk about, perfectionism and high achievers and people pleasing, and that's actually been studied. That those are the qualities that actually lead to chronic pain. And what's interesting, there are some times when I was telling you, I'll get little pain episodes here and there. And when I do my meditation and connection to God, and I ask for the message, I say, okay, what's this message, this pain? What is it trying to tell me? And what comes up sometimes is like, Anna, you're trying to impress these people. And I'm like, okay, let's forgive myself. Let's reel back and let's readjust here. And so we just have to tune in. It's just all about tuning in and listening to that message.
Which I love, because, we talk about, pain is a symptom, it's information, it's your body trying to tell you something. And I was going to ask you to circle back and go there. So it's not just, riding in the car, or, it's not necessarily a physical thing. It can be a physical expression of, hey, you're off path here. Which is, it is such an amazing gift when you are tuned into that level, right? Just listening to your body and like you said, tapping into your spirituality to say figure it out. Okay, what does this mean? What's my body telling me? What's off?
Yeah. And just like what you said about, I was just kind of getting off the path. Well, just recently, I was getting the message that I needed to leave this, major academic medical center I was working at. I was director. I was kind of at the top of my, I was associate professor. I was getting all these awards, and it took me a while to finally listen to that message, but I was having little headaches. I was getting this kind of headache pain, and I was wondering what was going on there. And I spent a whole week, because the headache, and I had some depression symptoms too, for an entire week. And I was really dug deep, connected to God. I meditated with God for several hours a day. It took me that long. And I finally, literally at the end of that week, I finally got that message, and it was like, I had to leave. And I was like, oh, I don't want to leave. I'm getting paid well. I'm doing so well. No. And then of course, this is my path now, and I'm going back, and here I am, I'm going back to residency. So this is apparently what I'm supposed to be doing.
And do your symptoms, once you made the decision to leave, what happened?
So it just releases. Yeah,
It's
it just
amazing.
releases.
And I just got goosebumps.
Yeah.
It's so amazing.
It's beautiful because just like we were talking about before we started the recording, is a lot of times when you're diagnosed with a chronic illness or a chronic pain disorder, it's like, hey, you're going to accept, which is good. You accept it. Yes, we accept the problem for sure, but we don't have to live with it forever.
Right.
You can truly heal yourself. There are the tools that I learned, you don't necessarily have to learn the tools that I learned. There are so many different tools to heal from chronic pain or from chronic autoimmune disease. But I healed. I don't have to take my steroids,
Right.
so I don't have to have excruciating pain and muscle weakness every single day. But I do have to tune in to what I feel is very healing for me, is that spiritual connection to my Holy Spirit, to God, and to allow those messages to be understood and to be learned so that I can take that lesson and move on from the pain.
So amazing and so beautiful. I have 800 questions I want to ask you, but I am really excited to bring listeners another piece of the conversation, because it's just people need to learn. So you are on the Inspired Living with Autoimmunity podcast, and we are talking about fibromyalgia. I want you to connect those dots for us, because I feel like this is new news for a lot of people.
Yeah. So many people know about fibromyalgia. I'm going to get really kind of like sciencey here, but
Go for it.
So fibromyalgia, it's a diagnosis, it's a disease process, but much like other diseases that really are just kind of vague and you can't see them, like migraines or ADHD, there is underlying pathophysiology, immunology, endocrinology going on in the body that is thrown off. And so then we start experiencing, especially women get this a lot more than men, as we said, it's a lot of hormone differences, and our brain is a little bit different too. Our nervous system works a little bit differently, but we get this widespread muscle pain, joint pain, stiffness, we get fatigue, we get this cognitive, dysfunction, kind of brain fog type symptoms. It's a lot of emotional kind of dysregulation, some anxiety, some depression, a lot of sleep. We don't sleep as well as other people. We get GI issues like irritable bowel syndrome, headaches, migraines, etc. And so what they found more recently, everyone was like, okay, fibromyalgia, there's no inflammation, which is not true. There is inflammation. There is nervous system inflammation, and there's immune system inflammation going on. And so recently a study done, I think it was in the UK, it's in the Journal of Clinical Investigation, and they took antibodies from people with fibromyalgia and put them into mice that didn't have any pain symptoms or fibromyalgia, and the mice got fibromyalgia. And so they found that they took those antibodies from people who had fibromyalgia. They're like, oh, so this must be an autoimmune disease, because
we just haven't identified.
No, we haven't. There is 50% of fibromyalgia. Typically, you could have a small fiber neuropathy, or there could be neuropathy going on for most of all people who have fibromyalgia, and that actually could be caused by an autoimmune disease. So some people hanging around with just the diagnosis of fibromyalgia and not neuropathy, 50% of them are going without that diagnosis. And so that's like that body's destruction of small nerve fibers that produce pain or different temperature sensation. For us with fibromyalgia, we have a decreased cold threshold. So we don't like cold on our bodies. That's why a lot of us do better with warmth. But there's more. So that's not just it with the immune system. There's a whole lot more. And so one of the other things that happens is, and this is also probably in the last few years been more recently studied, there's neurogenic inflammation, meaning inflammation in the nervous system, they're in the dorsal root ganglia, and that is those spinal nerves that come out of our spinal cord on our back in between our vertebra. There's these dorsal root ganglia that actually are producing a lot of inflammatory substances along those nerve pathways that actually go to the central nervous system, to our brain and to our spinal cord, and also go into our periphery, all in our skin, our muscles, our tissues, even our organs. And so even though I say inflammation, the fibromyalgia is not well treated with the anti-inflammatories like ibuprofen or naproxen. So it doesn't typically help the pain. But there still is inflammation going on. But it's more in a place where those meds can't typically reach. And so like the spinal cord, the brain also has many different inflammatory substances being produced, more so than a healthy individual. And that is most often it's interleukin 8. And that is, a really inflammatory cytokine that is caused by our nerve immune cells called the glial cells. And those are involved in the dorsal root ganglia, the spinal cord, the brain. And so it is kind of involving a lot of mast cells, monocytes, neutrophils, all these different inflammatory factors. So it's like this big inflammatory soup in fibromyalgia that is not treated with normal anti-inflammatories. And that's not just it. There's also a lot of oxidative stress, which comes from reactive oxygen species and perhaps a little mitochondrial dysfunction as well that can result in the progression of fibromyalgia. So that's a lot of what the immune system dysregulation and that autoimmunity is. So there's no like main antibody, particularly in fibromyalgia, that we're really testing. So it's hard to treat as an autoimmune disease. However, we still have to take care of that inflammation and regulate the immune system to our normal state. But that's not just it. This is part of that's just part of fibromyalgia is the immune system. The other aspects are our nervous system and our endocrine system. And so we've got all these neurotransmitters involved that we may not have enough of and that we may have too much of in fibromyalgia. And a lot of us have heard about serotonin and norepinephrine. Well, us with fibromyalgia, we don't have as much serotonin and norepinephrine, which are those feel-good chemicals, but they are also they actually inhibit pain. Those are the neurotransmitters in our spinal cord that actually activate the descending pain pathways that stop the pain. So you've got two pain pathways, one that makes you feel the pain that's ascending toward your spinal cord and brain, and the one that's descending that stops the pain. And that's where serotonin and norepinephrine are real big in and can stop that pain. So that's why we give a lot of SNRIs or serotonin and norepinephrine reuptake inhibitors to give you a little bit more of that serotonin and norepinephrine hanging around in your spinal cord to activate those descending inhibitory pain pathways. And then there's also some other inflammatory neuropeptides like glutamate and substance P that are involved. And so sometimes people do like a low glutamine or low glutamate diet to help decrease some of that excitatory, painful neurotransmitter. In brain scans of people with fibromyalgia, our pain pathways are way overactive. Our reptilian brain, that limbic system, that's like that fight or flight, the emotional, fear type pathway, that's like super active in people with fibromyalgia versus like healthy people. And then people with fibromyalgia also have a endocrine disruption where our cortisol, that's helps us with energy, provides us with resilience against stress, keeps us from having shock when we get sick. Well, we have a blunt in that cortisol curve, so we don't have as good of a cortisol response to stress. So our endocrine hypothalamic pituitary adrenal axis is dysregulated and thrown off. And not only that, but also we don't have as much growth hormone secretion at night. And so that also affects multiple factors in our body in terms of regeneration. So it's just multiple factors going on in fibromyalgia that really is just often, being treated either, which is not necessarily right either, but opioids, duloxetine or venlafaxine, like SNRIs, SSRIs, it's all, great, but we're still not treating
You're still treating a symptom or a piece of the pathway.
Right. Yes.
Wow. I feel like,
sorry,
okay,
that was a lot.
I'm done. I learned so much. Listeners, you are welcome. You can play that back. But it makes it, what I'm so excited about is when I was diagnosed with fibromyalgia, oh gosh, I don't know, 15 years ago, was again, and I had said this before we recorded, I felt like it was like, oh, you have pain, you have pain that doesn't fall under your rheumatoid arthritis pain. And so I feel like back then, especially woman who had fibromyalgia symptoms, either was made to feel like they're crazy, or it's all in their head, or it was like, we don't know, we're just going to stick fibro on you. And beyond the SNRIs, the SSRIs, that was all they did.
Yeah.
Back then. True. If then, actually, it was probably before they were, it may have been five years later. Yeah. So I'm like, well, wow, there's so much more to the puzzle.
Yes.
And again, all of those disruptions and dysregulations that you just shared, like, they're not the cause, right?
No.
So when we talk about functional medicine being root cause medicine, or, it's going after each of those pieces separately, it isn't actually going to heal you.
Yeah, true. It's, and that's where you have to listen to the patient's story. And oftentimes our story, thank God I had a great, medical team for mine. I got so lucky, probably because I prayed so much, but, you really have to listen to each patient's story and understand where that pain is coming from. Take a look at the diet, the nutrition, their environment, any toxic relationships, trauma and PTSD, just like we talked about previously, is a huge part. The emotions, actually, there is some evidence where emotions can create some autoimmunity in and of itself. And also, we already know the emotional pathways are along the same anatomical pathways as pain.
Can you please say that one more time?
So the emotional pathways, so our emotions, those pathways are along the same anatomical pathways as the pain. So they are really combined. You can't separate emotions and pain. You just can't. So pain can cause emotional pain. Emotional pain can cause pain. And that's why there are a lot of actually really good studies on pain reprocessing therapy, or other types of more positive intention, hypnosis, creative visualization, to where we can modulate our pain and treat our own pain through the power of our mind, our heart, our spirit. And there's actually evidence to that in emotional modulation, or what they call supraspinal self-regulation of our pain. And that's where those mind-body therapies come in. And so I use a lot of self-hypnosis. I use a lot of medical intuition to help my own pain, and also the women that I coach. But in traditional medicine, we do a lot more like cognitive behavioral therapy and then clinical hypnosis. So it's a little bit different in terms of which, kind of medical system you're in.
Wow. And this, I told you, I literally do think I physically jumped up and down when we talked about, that we're going to talk about this. I want to back all the way up though and ask, I'm going to throw you under the bus here, but I'm pretty sure you can handle it. We talk about spirituality, and for you and your journey, that's, faith, God, Jesus. What if somebody who's listening is not particularly religious? Can they still, I want to just touch on and because I can't remember if you said it here. I know you used the word universe when we were talking earlier. To me, there's always a workaround.
Yes.
And so, but I want to just share that with listeners for, it's okay. What is somebody who says, well, I don't know, because I'm not religious, so I guess I can't heal. No.
Yeah. Yeah. So it's interesting. Well, okay. So my background is a little interesting. So my dad is actually Muslim and my mom is atheist. And I am somehow, believe in God and Jesus Christ, probably because I see them. I don't know how, but anyway, hopefully that's not a hallucination, but, we in my coaching programs, I also work with people of all different kinds of faith and or people who aren't religious at all, and even people who are agnostic or atheist. And what's interesting is that in my intuitive healing sessions that I usually do, that's kind of the meat of my coaching program is the intuitive healing sessions, because the truth is you can be healed. And however, it's typically using a higher power, and whatever that is to you, your higher self, a universe, source, an energy that's just, you can't quite call it a name, then that is your connection. And that's your healing source. As long as it feels good to you, it feels healthy, it feels right, it feels divine, it feels sacred, then that is perfect. And that's how you use it. And it's really that higher power. When you connect to that higher power, it's something greater than you, because that power is so limitless. And we're just we're in this limited field. And so in order to access that healing energy and that healing power, we do have to truly ask to be healed through that intuitive healing connection. And then we're like, oh my gosh, I can't believe we just did that. I can't believe I can heal myself just through the power of belief, through the power of visualization. And studies have shown this, and we talked about this a little bit earlier, but Dr. Bruce Lipton, who talked about the biology of belief and how just by believing and thinking that we're healed actually changes our cells and our tissues and the receptors on our bodies and the communication that goes on with all those neurotransmitters and hormones and immune system, that we can actually positively change our body for the better. And much like all the other mind body therapies like hypnosis, etc., guided imagery, you name it, does the same thing, as long as we truly intently believe that we can heal.
And so it's not the power of it is the power of positive thinking, but it's not wishful thinking. That
right.
was it's not. But when you get to that place where you can shift the belief system, it changes the biology.
Yeah, there's a way to do it. There's actually several ways to do it, because you still want to believe, but you have to really believe and change your limiting beliefs to a thing that you can believe in. And so it's these subtle changes that you can get to that really gets to this next big belief. So it's pretty fun. I actually had a coach help me with that. It's like they did neuro-linguistic programming is how I kind of changed some of my beliefs. So yeah.
And do you practice NLP?
I do. I learned from them. So what's her name? She wrote a book. It's not Martha Beck. It's Byron.
No, but Katie. I like her.
I do. I like Martha, and she does similar. Byron Katie. Do you know Byron Katie?
I do not.
Oh yeah. So anyway, she wrote a lot of healing books, and so we kind of took her methods and used that to access our limiting beliefs, become aware of our limiting beliefs, like I am not worthy, and then switch it to be like, is that true? Well, no, because, oh my gosh, I've done all these, amazing things in my life. And so then what is true then? Well, yeah, I mean, I am good at learning. I am good at making friends. I am nice. I'm kind. I mean, and so you start getting some evidence to where you can actually start believing the positive.
I love that. That's amazing.
Yeah,
and I know you
mindset.
mentioned also the power of visualization.
Yes, the visualization piece is really key. So this is where hypnosis comes in, and hypnosis is really about using your imagination with a goal or intention in mind. And so you'll see a lot of athletes use this in the Olympics, for example, and they'll like play out their gymnastic, event and then actually win the event because they believed it, they visualized it in their head, and they've
already won this race. Yeah.
Yes, exactly. And they performed it perfectly. And so actually that's what we use. I actually do a ton of hypnosis actually in conventional medicine clinics, and it is amazing. And the evidence is amazing for chronic pain, actually. And so we actually have a whole pain foundation for kids with chronic pain. It's actually at Stanford Medical Center that we actually teach quite a bit of hypnosis using our visualization with a goal. Like, say, if we want to release headache pain, we just go into a safe space in our mind, could be the beach, the mountains, an imaginary place. Look at what that fiery head pain looks like. It could be red, fiery, maybe black, sticky substance. Have this powerful healing hands, grab it, take it out of your head, put it into this treasure chest, bury it deep in the ocean, chuck it across the universe, blow it up. And somehow that visualization, using the power of our imagination, actually changes the pain pathways.
It's so incredible. And I know all of this, and it's so incredible.
I know. It's
so amazing.
It's amazing. And I didn't know a lot of, adults do it, but I didn't know kids would do it, and kids love it.
They're probably better at it.
They're better at it. They're so much better at it. They're better at it because of the imagination. They can daydream.
Yeah, it hasn't been, totally taken away from them yet, and buried.
Yeah.
So that's amazing. Wow. Incredible. Incredible. Yeah. So, and these are things people can learn to do themselves, so they can use the tools, because as we talked about, like you said, none of us are ever completely pain-free, right? Like whether we've had a chronic pain condition or not, it's just part of, and I always say, we're constantly changing, healing, growing, shifting, and so I just think it's incredible to once you get those tools, like you were saying, like you check in, right? And sometimes I'm sure it's a quicker hit. Sometimes it takes hours and hours and hours.
Yeah, definitely. And it just
but there's
depends.
Skills.
It is. It's a skill to learn, but you can learn it. It's not like something you have to go like the great thing about this, especially with chronic pain or fibromyalgia, the thing about chronic pain and fibromyalgia is that you can so easily do it just with the power of your mind. Or your heart, your spirit, whatever you want to call it. Because there are so many great studies out there showing that just a lot of some of the techniques and therapies that we talked about, whether it be hypnosis, whether it be just, believing and positive thinking, reprogramming your limiting beliefs, making sure you're not catastrophizing and you're really, intently visualizing a beautiful day without any pain. You can move your muscles, you can exercise without any problems, you have a lot of energy, then somehow every day you just get a little bit more of that and a little bit more of that. And it's so amazing how we have that power. And it goes, we don't talk a lot about it in the conventional medical system.
I was saying earlier, all the things that I used to think were so woo-woo are so science-based and true and real. And this is why we're having these conversations, right? To change. I don't know that it'll be in my lifetime, but I really look forward to the day when medicine really is all encompassing.
Yeah. I think it will be. And I have hope for it. As long as industry is not as involved in money making, then I think we have a chance. So we'll see which wins.
Yes. Well, and look at you. I mean, going back and and going, back to
Nurturing myself.
residency again. And so I expressed gratitude off air. I'll say it again. I'm grateful for, my goal is always to get the word out to people, but also, that you're practicing, right?
Yeah.
That you're there changing the system. So thank you for that.
Yeah, we'll see. I hope to keep going. Thank you so much. I love being on the show today, Julie.
It's so amazing. So what is one step that listeners can take starting today to start to improve their health?
So this is a morning ritual that I usually start with in my coaching programs for women with chronic pain or fibromyalgia. And the very first thing when you wake up in the morning, because intent, that biology of belief that's setting yourself up for the day, is actually going to create that reality. That energy that you have is going to create that reality. And that energy is your thought process and that belief process. And so whenever you wake up in the morning, just how that would look like to you, it'll probably just be 2 minutes in your energy. You don't get tired after you're just happy. Calls to that reality in your day. And I don't know, it's crazy how it works, but it works.
Give us the one thing again. It paused
shoot
4 times. I'm like,
bummer.
darn it.
Okay, yeah. Okay, yeah.
Just
so I can
start with the one thing again. Sorry.
Okay, start with the one thing. Okay. All right. So the one thing is my favorite morning ritual is starting off with your ideal visualization of the day, because setting up your intention sets up your energy and that reality for the day, because how you are thinking, how you are believing, how you are visualizing is going to call that energy to you for that day. And it's actually a consistent habit, because the more you do it, experience an amazing, energetic. Typically do it on your pain. You could just imagine you are experiencing exercise without any exacerbations of a pain flare. You are able to have enough energy to make your own meals, nutritious meals. You don't have that afternoon slump. You eat lunch. You don't have to rely on a whole bunch of caffeine throughout the day. You're happy, you're joyful. And so it's just that actual visualization, just thinking, imagination, believing that's going to happen for you, that somehow it actually does.
I love that. That's so, because I know how powerful it is. One of my absolute favorite sayings is, where attention goes, energy flows. And this sets you up for that. It really does. And if you're listening to this conversation and this is all new, I understand you're thinking, no way. Yes way. And there's no special ability required. We all have this ability. So do the one thing, start with your morning visualization. And I'm going to add from who I work with and what I do. If you don't have fibro, and you're lucky enough with your autoimmunity to not have, honestly, even the healthiest people should be doing this, because this is how we manifest. It's why manifestation works. And so I say there's nobody that won't benefit from adding this to your morning practice.
Yeah,
so
I agree.
Gosh. Thank you so much.
No, thank you.
For people that are listening on the go and aren't going to check out the show notes, which will have all your links, where's the best place for them to find you?
The best place is my website right now, and it's healthispowher.com, and that's POWHER, because I do a lot with women, just because women are often, are often underrepresented in the health care field. So healthispowher.com. You can just find the podcast on there. You can contact me there. There's my programs there. So I'm always happy to chat.
Have to check out her podcast. And again, the links will be in there too, but Health is PowHer. It's awesome.
Julie's going to be on, so you got to listen to that show.
Can't wait. Can't wait. Anna, thank you so much. You shared amazing gold with us today. I mean, seriously, if listeners just start doing that morning practice, they're going to experience shifts. It's going to be incredible. So I'm telling you guys, please do it.
Yeah. Thanks, Julie. Thanks everyone for having me.
For everyone listening, remember you can get the show notes and transcripts by visiting inspiredliving.show. I hope you had a great time and enjoyed this conversation as much as I did. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.